Hello students. Welcome to part 2 of chapter 15, weight management. Now we're going to talk about causes of obesity, energy imbalance. Although some people have congenital obesity, a major contributor to obesity is physical inactivity. Please understand that there is no diet that is going to work without physical inactivity. Weight loss interventions that include physical activity can help to reach optimal body weight, BMI, body mass index, waist circumference, blood pressure, lipid profiles, and insulin insensitivity among people independent of changes to dietary intake. So now energy imbalance, which is more energy intake from food and drink than energy output through physical activity and basal metabolic needs results in excess weight accumulation. So if we have more intake than our physical activity, we are going to have weight accumulation. Excess intake of macronutrients, proteins, carbs, or lipids is stored in the body as fat. Not only the fat is stored as fat, but also the proteins are carbs, okay? Approximately 3,500 kilocalories is stored in each 1 pound, okay, of body fat. So if one person is storing 35 kilocalories in 1 pound, right? 2 pounds is going to be 7,000 kilocalories. 3 pounds is going to be 10,500. Okay, so just think about how many pounds is your weight, right? Somebody that is having 200 pounds multiplied by 3,500, and there you go. Okay. So now hormonal control. Here is a very nice equation, okay, that you can use for this for this calculation in terms of how many calories, how many pounds, the energy intake, and the energy expenditure. Hormonal control. So we have leptin. Leptin. A research group at Rockefeller University first reported that the obesity gene, in an overweight strain of laboratory mice. So they saw an obesity gene, or what they thought it was the obesity gene. So these researchers located the human equivalent of the same gene, and is known as leptin, the hormone leptin. Okay. First, they located the obesity gene in the mice, and then they found the equivalent in the human body, right? Which is the hormone leptin. And this is coming from the Greek word leptos, meaning thin or slender. Leptin release from adipose tissues controls satiety, and in people by serving as a negative feedback mechanism against the overconsumption of total energy. Plasma leptin, when I say plasma, I'm talking about the blood work in general, in the circulation. So plasma leptin levels rise after weight gain and drop after weight loss. Again, plasma leptin levels rise after weight gain. So when you are overweight or obese, immediately leptin is going to appear, and drop after weight loss. Okay, recent findings show that the brain produces leptin in that it is involved in many diverse functions in the body, such as blood pressure control, cardiac function, immune function, autonomic regulation, reproduction, and bone formation. So leptin is a big deal in this game in terms of weight management, right? And not only weight management, but also is related to diverse functions from blood pressure, all the way to bone formation. Obesity is associated with leptin resistance. However, much like insulin resistance, it is often depends on the brain region and or cell type functions. Okay, so that's good to know. Leptin seems to control eating behavior and fat storage. Okay, we are just coming across this information. Now, the other hormone is called ghrelin. It's an enteric peptide ghrelin. So it's enteric means it's in the gastrointestinal, right? Ghrelin is a peptide stimulant that the stomach secretes to activate the appetite regulating network. Ghrelin increases food intake and seems to promote lipogenesis. So the creation of fatty cells, lipogenesis. Certain foods of ghrelin increase during fasting. However, other forms of ghrelin do not change. Oh, very interesting. Ghrelin increases during fasting. However, other forms of ghrelin do not change. Genetic and environmental factors. Genetic inheritance probably influences a person's changes of obesity more than any other factor. Family food and lifestyle patterns provide an environment that allows this genetic trait to present itself. So these are the most significant factors in developing obesity, right? Genetic and family food patterns. That's good to know. NCLEX alert, okay? Genetic and family food patterns. Now, genetic control, obesity for the most part is a polygenic disease, polygenic, multiple genes, right? Meaning that there are multiple variants accounting for a person's susceptibility, and there are more than 200. Now, epigenetic research indicates that maternal and paternal obesity, as well as the prenatal environment, may also affect long-term growth and metabolism in the offspring. So again, epigenetic research indicates that maternal and paternal obesity, because they are both combined when the baby is created, right? As well as the prenatal environment, how well was the nutrition of the woman, right? May also affect the long-term growth and metabolism in the offspring. That's why nutrition during pregnancy is so important. The genetic influences of the predisposing factor, but not the determining factor. The genetic influence is the predisposing factor, but not the determining factor. The daily life environment and habits that a person chooses influence the expression of this genetic trait. As I always say, you can have the gene, but if the environmental factors are not a good host for the gene to develop, then it's not going to develop, right? If the nutrition is appropriate, if you are living in an environment stress-free, if maybe you are living away from these towers, 5G towers, there is a lake next to your house that the water is contaminated, all these factors are going to promote the good environment for the gene to express. But if you are living in a natural, a lake that is out of these toxins, you are not living close to a 5G tower, you are losing less radiation in your life. What type of radiation, Professor? Your microwave, for example, right? If you are cooking naturally with less radiation, you are using less microwave. So then you are going to provide the bad environment for the gene to express. Okay, now family reinforcement. Families exert social pressure and teach children habits and attitudes towards food. Yes, establishing inappropriate family food patterns at this age can reinforce an individual's genetic predisposition for increased body fat. Yes, so the way parents are, the children is going to be. That's mathematics. 1 and 2, 1 plus 2 equals 3. We know that overweight and obese children are at significant risk for remaining overweight or obese as adults. because memory cells exist, right? From 0 to 7 years old, you are creating memory in the cells of your child. What is this child eating from 0 to 7? Okay, that is going to give you a prognosis how his adult life is going to be. Thus, the development of healthy eating and physical activity habits during childhood and teenage years are highly encouraged to establish balanced food and lifestyle patterns. Now move to physiologic factors. The amount of body fat that a person carries correlates to the number of and size of fat cells in the body. Critical periods for becoming obese occur during early growth periods. Critical periods for becoming obese, that is the prognosis, how it's going to be in the adulthood when cells are multiplying rapidly throughout childhood and adolescence. That's why. Women store more fat during pregnancy and after menopause in response to hormonal changes. Yes. And here we are going to see two graphics talking about genetics and the predisposition for obesity. So when comparing the prevalence of obesity among various racial ethnic groups in the US, researchers have found significant differences with regard to the risk for obesity in men and women of varied race, ethnicity. Okay, so for example, we are going to see the high tower here is the red one or orange, depending on your computer. We can see the red orange is in women. Okay, if I make it bigger, if I zoom in, you see there is a letter A and B next to 54.8, which means it's significantly different from non-Hispanic Asian persons and significantly different from non-Hispanic white persons. Okay, and now next group is going to be women again, 50.6, A and B as well, right? So, but the green are Hispanic. So the first place is the non-Hispanic Asian persons, and the second is the non-Hispanic white. And then the third would be the woman, and it's the color green that are Hispanics. Okay. Okay. Let's move. Another dramatic difference was noted when looking at the data for prevalence of childhood, 2 to 19. Let's see, boys in the green section are going to be Hispanic. And then what letters we have here? We have A and C. A is going to be non-Hispanic Asian persons, right? Minus significantly different from non-Hispanic black persons. So you see that in the boys. It's very sad. Now, there is another graphic here. This is a very interesting graphic. It's talking about the interwoven influence among genetics, environmental effects, physiology, behavior, and energy. So for example, we have the environment here, right? And this environment is going to trigger certain behavior, right? Maybe there is a family full of stress and fights, and they have financial issues, and they live next to the lake that is full of toxins, or maybe they are having the 5G tower. Now their behavior is going to be very, very bad, right? This person is being educated in an environment of violence, aggression. Then the behavior is going to trigger the food choice. So now I need more carbs in order to calm my anxiety, and I need comfort food full of carbs and sugar. Now my metabolism is going to be bad. Now my physical activity, if I am sedentary, is going to trigger a lot of consequences in my physiology, right? But if on top of that I'm having a genetic factor the physiology is going to meet all the history that I just mentioned. So you can try to put yourself in this diagram and see what is the relationship. Psychological factors, work, family, and social environment may cultivate emotional stress, which many people respond to by eating comfort foods. Other environmental factors, an increase in energy-dense food availability, low-cost, fast, and convenient foods, increase in portion sizes, and a decrease in food preparation time and skills. Environmental factors related to lifestyles that contribute to energy imbalances includes a decrease in physical activity, increase in screen time, television, computer, video games, less active leisure times, and decreased physical requirements for activities of daily living. Don't get me wrong, we're talking right now about obesity, overweight, but people that are also very skinny, okay, they have malnutrition and they can have all these factors that trigger that malnutrition, right? So in this specific case, we are talking about obesity, but think about the same way on the other side of the table, right? Individual differences and extreme practices. We have to consider individual energy balance levels, the energy out factors such as the basal metabolic rate, right? And the basal metabolic rate is the minimum number of calories required for basic functions at rest. So how many calories do we need while we are sleeping for our body to continue functioning well? Okay, that is a refresh because we reviewed this concept before. Now we have the body size, lean body mass, age, sex, and physical activity influence the total daily calorie expenditure. Now, also we have to consider energy in. Remember, we are talking about individual differences and extreme practices, right? So everybody has a different energy out, energy in. Extreme practices, desperate attempts to lose weight may drive people to extreme measures, which sometimes worsens the health risk. Now, the fat diets, very popular, a huge topic here. The book is providing a very nice comparison table among all different diets that you have to dig in and review. So diet books and weight loss supplements that promise to melt the fat away continue to flood the American market. These books and supplements usually sell briefly and then fade away, largely because their quick fixes either do not work or are not sustainable. And I'm gonna keep the last thought. They are not sustainable, okay? So most of the fat diets fail on the following two concepts. First, scientific inaccuracies and misinformation. Yes, there are not enough research for the diet to double check if they are they are real, right? And then failure to address the necessity of changing long-term habits and behaviors. And that's basically most important concept. In order for a diet to be successful, yes, we have to reduce the amount of calories, but we have to increase the amount of activity. However, we have to work on the habits and behaviors, and that includes the psychological, mental state of the patient and the habits. We need to work on that. If we don't change the habit, you can do the bariatric surgery, you can do the Atkins diet, the intermittent fasting, whatever diet it is, but if you don't change your mind, you don't change your habits and your environment, yes, okay, if you keep living in that stressful environment, if you keep living with people that is still they are eating french fries and fried foods and you don't make the difference for yourself, any there is no diet that is going to work. Okay, so with some diets the degree of energy restriction is impossible to maintain long term. Exactly. is not sustainable. Many fat dieters find themselves caught in a vicious cycle. This is called the chronic dieting syndrome, and it's harmful physically and with psychologic effects. So, comparison of select common weight loss diet. You have the Atkins. Always pay attention. There are 3 to 4 columns that I want you to pay attention. The most important are the health claims scientifically proven. That's the most important. Lose and maintain weight. And also, please check the foods to avoid. That is going to tell you if it is sustainable, right? In the case of Atkins, for example, they are asking you to avoid carbs, specifically bread, pasta, more fruits, and high carbohydrate vegetable meal, alcohol. Well, it's not going to be bad at the beginning, but is it sustainable in the long term? And then you have to eat meat, fish, poultry, eggs, cheese, which is high in fats, high fiber, vegetable, butter, oil, nuts. We know that the Atkins is high in fats and there is a risk for cardio, right? Cardio issues. Then you have another diet which is called the HCG. It's daily injections of human chorionic gonadotropin hormone to keep the body in an anabolic state. Then you have the intermittent fasting, very popular, partial to complete fast 1 to 2 days per week. But it seems to me that this table, even though it's very, very nice done, it's not breaking down the intermittent fasting into the several types, right? You have the 12, 16, 24 diet, and all foods are allowed, only total calories limited on fasting days. And the evidence is telling us that exists for short-term weight loss, lack of long-term maintenance studies, unless you really change your habit. Again, possible if weekly caloric intake is lower than output. They are talking about here about if you can maintain the weight loss. Now we have another more diets here, the paleo, also very popular. What is the evidence saying? No theory and long-term results not validated. And then lose and maintain weight, possible if caloric intake is less than output. And you keep reviewing the diet and try to analyze the one that is of your interest. Here we have the Weight Watchers, very popular, promotes wellness and weight loss through diet, exercise, supportive community. That's excellent. This is a good point in the Weight Watchers, the community, right? The reunions, the meetings that they are promoting, they are marketing about this diet, right? And also in terms of evidence, that support that it produces weight loss up to 1 year. And then, can you keep the weight loss? Yes, if caloric intake is less than output. And there is a lot of types of programs available. What else? What you are not supposed to eat. No food is off limits and can be budgeted for in the daily point system. So those are good factors about the Weight Watcher. Then you have the Whole30, so Zone 1, 2, 3 programs. And you can go through and analyze all these diets. Now we have very caloric intake diets. These are diets that are the patient is eating less than 800 calories per day. Possible effects of a very low caloric diet include acidosis, low blood pressure, electrolyte imbalances, a loss of lean muscle mass, and decreased BMR, basal metabolic rate. When individuals resume normal eating after following a very low caloric diet, they frequently gain back more fat than lost initially. So they get into the yo-yo, right? You lose a lot of weight and then you go back again and you gain more weight. Now, specific macronutrients restrictions, avoiding any food group or macronutrient, carbohydrate, fats, or protein, as a means of for weight loss is unfounded. Okay, this type of diet that are specific macronutrient restrictions, such diets that are extremely low fat or extremely low in carbs, are usually too restrictive to maintain for extended periods, and they also carry health risks. And remember, we need certain amount of fats for our brain function. That's the most important that we need to remember, right? Brain function. Now, clothing and body wraps, yes, special sauna suits and body wrapping claim to help weight loss in certain body areas or to reduce cellulite tissues. We've seen it every day. Most of our friends, at least one, is engaged in these body wraps, right? The resulting small weight loss is a result of temporary water loss. And you have to remember that our body is 75 to 80 or maybe 85% water. And that water has electrolytes. So if you are losing water, you are losing electrolytes, which is very dangerous. Weight loss drugs. Because of potential fatal complication, diuretics and exogenous hormones used to alter body weight or lean tissue mass require strict medical necessity and supervision. Various amphetamine compounds were once popular for the medical treatment of obesity. I remember it was very popular in the 90s. Everybody was taking amphetamines. And yes, they were losing weight, but then they went into the rebounds stage, the yo-yo, right? However, they are dangerous health consequences and they are no longer used. Yes, I remember many of my friends who were having problems in the kidneys, kidney problems, kidney pain in the kidneys, right? Because they were urinating a lot. And sometimes because they were taking amphetamines, they develop kidney problems. Common over-the-counter drugs include phenylpropylene, so acutrum, dexatrim, which is a stimulant that is similar to amphetamines, and ephedra, which is currently banned in the United States, thanks God. So then we have weight loss drugs like fenfluramine and phentermine were previously prescribed together in the popular FEMPEN combination for weight loss. Shortly thereafter, physicians found that 1 in 8 clients who were using the FEMPEN, okay, develop valvular regurgitation, which can be fatal. Valvular regurgitation is related to the heart, right? The FDA, with the support of the medical community, quickly removed that medication in 1997. In 2010, the FDA withdrew sibutramine Meridia from the U.S. market because of the increased risk of heart attack and stroke with its use. Okay, so now prescription medications that treat obesity generally work in one of the following 4 ways. Again, prescription medications that treat obesity works in 4 different ways. One is reducing energy intake by suppressing the appetite. Okay. 2 is increasing energy expenditure by stimulating the BMR. 3 is reducing the absorption of food in the gut. And 4, altering lipogenesis and lipolysis. Lipogenesis is the creation of fat, right? Genesis, lipo, and lipolysis is the destruction of fat. Lysis, lipo. The FDA approved Orlistat or Ali or Senecal for the treatment of clinically significant obesity in 1999. Orlistat inhibits dietary fat absorption and has been successful with weight loss, but reports indicate that maximal benefit occur only when it is combined with lifestyle changes that induce a negative energy balance. So in other words, lifestyle habits, behavior, okay? As with many medications, unpleasant side effects are associated with this medication, like diarrhea, gas, and abdominal pain. Diarrhea, gas, and abdominal pain. Now, here you have a very nice article about Orlistat, okay, that you can go deep and read. Now, the FDA approved 2 other drugs in 2012. One drug is lorcaserin, affects certain serotonin receptors to enhance satiety. This thus decreasing caloric intake. Phentermine topiramate reduces caloric intake by slowing gut emptying. That's another type of medication that is very well known as Casemia. Okay, and the previous one is Belvic. Okay, let's talk about surgery. Your favorite. I know you were waiting for this. Surgery studies show that bariatric surgery provides significant and sustained weight loss and a reduced relative risk of death because of a decrease in several conditions and comorbid diseases associated with obesity. It is not without risks and complications. There are 2 primary types of surgical procedures for weight loss: for restrictive, right, which is making the stomach smaller, and combination restrictive and malabsorptive procedures, which is making the stomach smaller and inducing malabsorption. I don't like that. For fasting banding, a surgeon places an adjustable gastric band on a client's stomach during laparoscopic surgery. Using a small port, the band is subcutaneous adjusted as needed. And then we're going to see the picture. And then we have another one that is very popular. The most commonly performed is the Roux-en-Y bariatric procedure. This procedure restricts the stomach to about 20 to 30 ml, reconfigures the small intestine, and may lead to neuron and hormone changes within the gut. Neuron. Wow, the gut is full of neurons. Is the second brain of the body. So they are going to change the configuration of the neuron and, of course, the hormones. I don't like that. Because of the reconfiguration of the small intestine, the client needs vitamin and mineral supplements for the remainder of his or her life, of course. The most common nutrient deficiencies include iron. I don't like to have a deficiency in iron. Calcium, my bones are going to suffer. Vitamin D, my bones are going to suffer. Vitamin B12, the quality of my cells are going to suffer, but neurologically, B12 is one of the most important vitamins. The inherent risk for surgery and post-surgical malnutrition are critical issues for the client. So following the procedure, we have the risk for dumping syndrome. Dumping syndrome, don't get confused with dumpling, okay? It's dumping syndrome. So the RDN will counsel on the importance of decreasing simple carbs intake, avoiding fluid with food, and determining portion size and an eating plan, okay? So if you are a person that is having 2 arms, 2 legs, and you can really walk and exercise, why do you have to put yourself in such a risk of this type of surgeries? I'm asking you, just asking. A more limited type of cosmetic surgery developed during the 1980s in a form of local fat removal, which is lipectomy or liposuction. I don't like that because also if the doctor is not an expert, bumps can be created in the area where liposuction was conducted. I've seen patients that they're having nice flat abdomen, but on the side they're having kind of bumps years after the liposuction. Anyway, so here is the adjustable gastric band, okay? Then you have the Roux-en-Y gastric bypass. Look at that. Esophagus, stomach is very tiny, and the small intestine is immediately anastomosed attached to that tiny part of the stomach. And then, because they don't want to lose the part of the intervention of the gallbladder, liver, and pancreas, then they reattach another part of the intestine using the side of the duodenum. Wow, very complicated, right? Now, a sound weight management program. Weight loss requires hard work and strong individual motivation. That's good to know. That's it. It's all about motivation. The most recent position paper in the Academy of Nutrition and Dietetics regarding weight management states that successful treatment of overweight and obesity in adults requires the ability of adopting and maintaining lifestyle behaviors which contribute to both sides of the energy balance equation. So, lifestyle behaviors are influenced by several factors at different levels of the socio-ecological model, which include factors at the intrapersonal, community, organizational, government, and public level. So we have behavior modification, the basic principles. There are three basic aspects of each undesirable eating behavior. One, cues or antecedents, two, the response, and three, the consequences. So we need strategies and actions, right? A successful program of personal behavior modification for weight management focus on the following: management of the eating behavior, food diary that inquires when, where, why, how, and how much. Two, the promotion of physical activity to increase energy output. And three, the pursuit of emotional, stress, social, and psychological health. And when it comes about nutrition, behavior and mental status is the most important. It's not economics. It's the mental status and the environment, right? The behavior of the people around us that is going to trigger our own behavior. Defining problem behavior is important. Recording and analyzing baseline behavior. So you need to have recording eating and exercise behavior and carefully analyze in terms of physical setting and people involved. So let me share with you in my capstone project, I was working with breast cancer survivors in order for them to avoid recurrence, right, of breast cancer. So the most important we did was first we were checking their mental state. We kind of analyzed their psychological and we were working on their stress and their fears, blah, blah, blah. And then we created logs for how was the physical activity within the week, and we created very close monitoring for their daily nutrition and intake. We were doing follow-up for breakfast, lunch, dinner, snacks. We were there, and they lost a tremendous amount of weight. I would say on average 80 pounds on 12 weeks, and 12 to 14 weeks, yes. And then they kept this because they changed their habit. So that was the most important for them. Okay. And so far there is no recurrence. Dietary modification, basic principles. So that's good to know. Pay attention to the realistic goals. Goals must be realistic in terms of overall weight loss and rate of loss. Averaging half to 1 pound per week or no more than 2 per week for clinically severe obese patients, okay, for clinically severe obese patients, right? So this is a realistic goal. So number two, negative energy balance. Number three, nutrient adequacy. Number four, cultural appeal. That's also extremely important. The food plan must be similar enough to an individual's cultural eating patterns to form the basis for a permanent alteration of eating habits. And then energy readjustment to maintain weight. So those are the basic principles of the dietary modification, okay? Energy balance components, the two sides of the energy balance equation are energy intake in the form of food or drink and energy output in the form of metabolic work and physical activity. And that's good to know. That's the secret. That's the secret for weight loss. Manipulation of either or both sides of the equation aid in success.